Hi. So my topic is the history of sulfa drugs. Sulfa drugs are a class of compounds that were discovered in the 1930s that are derivatives of p-aminobenzene sulfonamide, which you can see on the screen here. These compounds have a number of biological effects, and the effects and the activity of the drug changes as the ring substituent changes. So as you can see here, the NH2 group in sulfonylamide has been replaced with a pyridine group, and this drug has a different effect as the one that's shown above it. So these drugs were the first drugs that were synthesized which had an antimicrobial effect and were selectively toxic. That is, that they could cause harm to the microbe that they were trying to target without harming the host who's taking the medication. These belong to a class of drugs known as static drugs, which stop the bacteria or the microbes really from growing inside the body, but they don't kill them. So, like I said, these drugs were discovered in the 1930s, in 1932 specifically, and their effect, where they inhibit the growth of microorganisms, was first discovered in rats. After that, it took another 4 years for testing to be completed and for the drug to be manufactured and sold. So, this drug was produced first in Germany and it was sold under the brand name Prodonsil in 1936. Gerhard Domag won the 1939 Nobel Prize in Physiology or Medicine for the discovery of its antibacterial effects. However, he had to turn down the Nobel Prize because during this period of time there was a lot of tension in Europe due to the Second World War. And since he was a German scientist, the Nazi Party tried to convince him to not accept the award, but he did accept it later. It was later discovered that another compound, known as sulfonylamide, had a very similar antibacterial effect to the given drug. It turns out that protonsil is a nasodie and it's broken down to give sulfonylamide within the body. And this drug was effective against streptococcal infections. So, like I mentioned, protonsil is broken down within the body to sulfonylamide. And another compound that is produced during this reaction is 1,2,4-triaminobenzene. So, sulfonylamide is the active compound. It's structurally very similar to p-aminobenzoic acid, which bacteria require during the synthesis of folic acid, that is vitamin B9. So, as you can see here, sulfonylamide has this group which when replaced by COOH, that's the carboxyl group, would form p-aminobenzoic acid, which is a part of the folic acid, which is required for the synthesis of folic acid. So this acts as a competitive inhibitor and does not allow folic acid to be synthesized within the cell. And the presence of folic acid is essential for cell division. So, like I mentioned, this drug was selectively toxic. And the selectivity in the toxicity comes from the fact that folic acid in humans is not produced. We don't synthesize our own folic acid, we derive it from our diet. So, this compound does not affect us in the same way. So, for the next year, a number of sulfa drugs were discovered. Once the idea of a drug that was effective against microbes was established, they figured out that if they changed it a little bit, they could maybe come up with new drugs that were more effective or effective against different microbes. So, a number of sulfa drugs were discovered, the most popular of which was sulphapyridine, which was a drug that was effective against pneumonia. So earlier, pneumonia, especially in old people, had an extremely high mortality rate. And if you got pneumonia, there was a very high chance that you would just die. However, once sulphapyridine was discovered and then used in Britain to treat Winston Churchill's pneumonia, it gained a lot of popularity and people began to use it as a treatment. These drugs were also used during the Second World War, where they were used to clean out wounds from the war. A number of diseases like meningitis, gonorrhea, dysentery, and later leprosy, with the use of a drug known as dapsone, could be cured. However, it was discovered over time that these drugs had a number of adverse effects. So one of them was a higher instance of renal calculi, that is solid substances present in the kidneys. The symptoms of vitamin deficiencies were also aggravated when these drugs were being used. These drugs, which obviously pass through the liver once they're consumed, were found to cause hepatotoxicity, liver injury, and sometimes even severe acute liver failure. Sulphapyridine, the previously mentioned miracle drug that could cure pneumonia, was linked to the formation of solid particles in the urine. It also caused nausea and vomiting. So over time, since this was the first time we had found drugs that were effective against microbes and antibiotic resistance, although these are not antibiotics, resistance to drugs that microbes could develop was not really known of yet. So people didn't really take these drugs in a controlled manner or continue the dosage of the drug or taking the drug up until all of the bacteria were gone, like we are now expected to do with antibiotics. We're not supposed to stop taking antibiotics until we finish the whole course. So since that wasn't really something that had been established yet, due to never having treated microbial diseases before, over time bacteria began to develop a resistance to this drug because of the enzyme that was previously inhibited by para-aminobenzene sulfonic acid, now being mutated so that it could no longer inhibit the synthesis of folic acid. Plus, antibiotics, which were a lot more effective, were discovered in the 1940s. So these drugs, over time, they fell out of usage mostly. However, they're still used now to treat some microbial diseases like UTIs and eye infections and malaria. These drugs are removed from the body via the urine, so they are extremely effective when they're used as UTIs. They're also used to treat some parasitic infections. They're used as anti-cancer and anti-obesity drugs. They're used to treat thyroid and neuropathic pain. They have a diuretic effect, that is, they cause you to secrete urine, excrete urine, and they are also used in the treatment of type 2 diabetes. So this is because these act like insulin secretagogues. That means that they induce the body to sulfonylureas, the specific drugs that are used to treat diabetes. They essentially induce the body to secrete insulin. Now, in type 2 diabetes, the body either does not produce enough insulin or stops producing enough insulin over time due to damage to the beta cells in the pancreas because of overproduction of insulin. The thing is, in type 2 diabetes, most of the time, the body's cells are resistant to insulin, so it cannot carry out its full effect. Because of this, the cells in the pancreas keep overproducing insulin because the body reads it as not enough insulin being produced. Because of this overproduction, the cells wear themselves out and they stop working properly. So as the production of insulin falls, drugs like sulfonylurea are used sometimes in combination with other drugs, which make the body respond to insulin better in an effort to treat type 2 diabetes. However, this only works if the beta cells still retain the ability to produce some insulin, which, for instance, is not the case in type 1 diabetes. And it's also not the case in severe damage to the pancreatic beta cells because of type 2 diabetes overproduction of insulin. So I mentioned how these drugs work, and I mentioned how they were developed and how we use them now, but these drugs also have had a lasting effect on the pharmaceutical industry and the way that we approach medicine as a whole. For instance, these were the first ever drug that was synthesized, which had an antimicrobial action. So this was a ray of hope because diseases which were previously life-threatening, where people would just die of sepsis from getting a small cut, could now be cured. Additionally, it revolutionized pharmaceutical research. There was an increased interest in said research, and there was also an increase in funding. So because of this, over the next decade, there was a very rapid development of a number of very effective drugs. Additionally, it also led to the commercialization of the pharma industry. So previously, there weren't really any proper companies that would sell drugs. But once this drug was discovered, and once multiple such drugs were discovered, the focus in producing medications sort of turned from maybe individual small companies to large corporations that now produce medication. And these corporations put a lot of money into the research that they carried out. So again, that led to very rapid drug development. Additionally, for instance, I mentioned earlier that vitamin deficiency symptoms were aggravated when these drugs were being taken by the patient. So some of these companies also put money into research on vitamin deficiencies. So it wasn't just medication or the pharmaceutical aspect of it that was being studied, but also the biological impact that these had on the body and on animals. So also additionally, in during the sulfur craze in the US, there was an incident involving the sale and consumption of liquid sulfonylamide. So since sulfonylamide was a solid medication, you couldn't really get children to take it because most likely it tasted really bad. So there was it was suggested that people should create a liquid form of it. But sulfonylamide is insoluble in water, so they decided to dissolve it in a compound, an organic compound known as diethylene glycol, which is an extremely toxic compound. This compound has the ability to take off car paint, and this was what the sulfonylamide was dissolved in, along with raspberry flavoring to make it taste nice. And this was the drug that was consumed by a number of people. And consuming diethylene glycol led to extremely painful death. And ultimately, this incident led to the death of 107 people, a lot of whom were children. So the article that is present on the slide mentions 13 people, but this was when this is an article from when the sulfonylamide effect, the elixir of sulfonylamide effect was just discovered. So after this, there was also a change in how drugs that were entering the market were approached. So the FDA now had set a standard for the regulation of drugs entering the market. They needed to be safer and they needed to be tested, which while now it might seem ridiculous that we would ever allow a drug to enter the market without all of these things happening, wasn't really the case earlier. The regulation of drugs entering the market prior to these drugs was extremely low. People could just produce the drug, and as long as it was considered somewhat effective, it could enter the market and ultimately lead to extremely dangerous consequences. So, like I said, these are my references for this presentation. Like I mentioned, these drugs were a ray of hope, and these drugs did revolutionize and completely change how we approach medicine, and well, completely changed medicine, the field as a whole. Thank you.